Hi. So I've been having repeated heartburn, bloating, regurgitation, which is a taste of acid coming out of your mouth or something trying to come out of your throat. Then you may have something called hyperacidity. Hello, my name is Tina and I'm a pharmacist. And in this video, I will tell you about what acid reflux is, how to prevent it from happening, and how to treat it when it's already happening. Please make sure to stay tuned to the end. Now, hyperacidity is a discomfort that happens when there is high levels of acid in your stomach, and some of this acid will try to escape. Of course, your esophagus is meant to allow things in and not let anything out. So some of the things that can cause hyperacidity are your habits. We call them lifestyle habits, like staying hungry for too long. Some people, they eat dinner maybe like 5 p.m. in the evening, and 2 p.m. the next afternoon, you've not even eaten anything. Now, when you keep exposing yourself to hunger, you are stressing out your body. But then the most important thing is that you are causing your body to produce more and more acid. So there's something called a mucus layer that protects your stomach from the impact of acid. Now, the acid we are talking about is very strong, like it's like hot water. Like if it touches your skin, it can burn your skin. Now, this is the kind of acid that your body produces to digest food and kill bacteria that is found in your food and your stomach. So now when you keep exposing yourself to high levels of this acid, you can destroy the mucus layer that is meant to protect you from the impact of this acid. When you've done things that have depleted this mucus layer, you now give room for a bacteria called H. pylori or Helicobacter pylori to find its way into the inner layer of your stomach. And when this H. pylori gets into your stomach, it causes a sore. It eats into your wall of your stomach and causes a sore. And this sore is what you see as ulcers. Now, remember, when ulcer happens, it is very uncomfortable. Some of you may already have ulcers. Some of you may have or know someone who has ulcers. The pain can be excruciating and the discomfort can be very frustrating. Now, don't get me wrong, these symptoms can happen once in a while. Maybe if you eat food that has so much gas, like your beans, your egg, sometimes you belch, or you have this taste of acid come out of your mouth once in a while. But when this taste of acid or these symptoms happen more than 3 times in a week, especially the heartburn, then we say it is no longer just hyperacidity. There is something else that has gone wrong. And that something else that has gone wrong is called dysmotility. So now means there is now an abnormal movement. There is now a dysfunction in the muscles that are meant to hold this food together. So the sphincter is meant to close up and open up, close up and open up. So it opens up when the food is coming and closes when the food stays inside. So now when it now stays open, then we say there is now dysmotility. And when that dysmotility happens, we have to do something. If not, everything you eat will want to go out. To treat this dysmotility, we have to give something that will help to tighten this muscle. And in this case, we definitely need drugs to manage it. So when you have this heartburn, most of the time you take antacids, or you go to a pharmacy to get antacids, or get drugs like omeprazole or rabeprazole or pantoprazole. Now, it could be in the past that maybe your doctor has placed you on these drugs, and then over time, because of the repeated symptoms, you keep going to the pharmacy to get these drugs by yourself. The truth is, when you've been treating this heartburn and regurgitation like this for quite some time, it could be that you already have GERD. And for GERD, treating with just an antacid or with omeprazole or rabeprazole will not completely treat these symptoms. You will keep having relapse upon relapse. So to effectively treat this condition, we say we have to combine medications. We have to treat you with both the antacid or the omeprazole or rabeprazole alongside with a prokinetic agent, a drug that helps to tighten this muscle. So there are 3 steps to treating GERD. First is lifestyle modification. Now, what are those things that you do that trigger this GERD to happen? One of them is your eating habits. Eat more consistently. Do not skip breakfast. You have to eat in between meals. Get enough rest. Reduce your spicy foods, fried foods. They trigger high levels of acid. Avoid alcohol. If you must drink, then please drink on a full stomach. Avoid smoking. And of course, obesity is a factor that can cause hyperacidity. So one way is to reduce your weight, reduce your stress levels, because stress has been known to increase acid level and acid production. Sleep well. So now relaxing would help to reduce your cortisol level. Now cortisol is the hormone that induces stress. Always have antacids around you. Antacids help to reduce this acid level and keep your stomach calm. Drink enough water. So water is a natural antacid. Exercise. So exercise is a way to tone up muscles. Now you have muscles in every part of your body. Although the muscles in your stomach, you don't really have control over them. But exercise will help to tone up those muscles as well as the physical ones that you have. So after all these lifestyle modification, you can do them to prevent the symptoms, you can do them to treat the symptoms, and then of course you can do them alongside with treatment. So that brings us to the next stage, which is treatment. You see that your doctor gives you an antacid, which of course will just help to neutralize the acid, but is not really like stopping this acid from being produced. We have your omeprazole, Rabeprazole, pantoprazole, esomeprazole. So you see them with prazole. Now these drugs are usually prescription medications in many countries, and then of course sometimes you can still get them, over the counter in some places. But then these drugs, what they do is that they block this acid from being produced in the first place. So if your body doesn't produce this acid, then of course there is no hyperacidity. And when there is no hyperacidity, you don't have all those symptoms that you have. So this is one way to treat it. But now the thing is, these drugs will treat the hyperacidity. But remember that when hyperacidity happens too frequently, it can damage the muscles of the lower esophageal sphincter, the muscles of the GIT, which starts from your throat down to your large intestine. And when these muscles are destroyed, then you can have something called dysmotility. Now, dysmotility is an abnormal movement of these muscles. Your muscles are meant to go in a movement, like have a flow. But then, due to this, damage to these muscles, you have an abnormal movement. So foods are not passing freely. So you start having symptoms like constipation. You start having bloating. You start having diarrhea. You start having, food trying to come out of your throat, which is regurgitation. And then you start having taste of acid in the mouth, similar to the symptoms of hyperacidity. Now, when this motility happens, you must treat it. If not, it will just be there or it will keep getting worse. So to treat this motility, one way is to use a drug. So this class of drugs, we call them prokinetic agents. Now, these drugs must be prescribed by a doctor. Examples of these drugs we have like domperidone. So you cannot get them over the counter. You need a doctor's prescription. So to effectively treat GERD, you have to treat for at least 8 to 12 weeks. And after this treatment, you must follow up with those lifestyle modifications that we mentioned earlier, just so that you prevent relapse, prevent this condition from reoccurring. You cannot diagnose this condition by yourself. So once your doctor diagnoses you of GERD, then of course he will place you on a medication such as this. So if you've been having these symptoms for longer time and you've been managing it at home by yourself and it seems to keep getting worse or not even going at all, then please see your doctor to make sure that you get the right diagnosis to prevent it from getting worse. Now, the final stage for treatment with GERD is surgery. They have to treat it by cutting out that muscle. So surgery is the only way out. For surgery, if that is your case, then of course the doctor has to do a surgery for you to remove it. But even after surgery, you have to do all of these lifestyle things that we talked about. Now, you eat healthy, eat more than 3 times in a day, right? Drink lots of water, sleep adequately, have enough rest, right? Reduce your stress level, reduce alcohol intake or even stop it completely. Stop smoking and reduce your weight. Now, all of these are lifestyle modifications that you can do to treat and prevent GERD from reoccurring. I hope this video helps you. If it does, please make sure to like this video, subscribe to this channel, and share this video to your friends or people that you think that would benefit from this. And you can comment in the comment section just so I can know the kind of content to give you in the coming videos. I hope this helps. Have a wonderful day. Ciao.